From now on, you will need to take insulin every day. You are going to use two types of insulin. One is the rapid-acting insulin. This may be called NovaRapid, Numalog, or Apidra. Others may be available.
You take the rapid-acting insulin about 10 minutes before your meal. It starts working after 15 minutes and it stops working after about 4 hours. Exactly how long it lasts can be different for different people, but what is important is that the rapid insulin needs to be taken before every meal, breakfast, lunch and dinner.
You will also take another type of insulin which is called long-acting insulin. This is also called basal insulin. This long-acting insulin may be Levemir, Glargine or Degludec, depending on what your hospital has prescribed. Again, others may be available.
The reason why you need long-acting insulin is because your body always needs a background level of insulin to help you produce energy. The insulin can be given at different times during the day, but it must be at roughly the same time each day. We normally suggest in the evening, just before bed, so you can get into that routine. If that is not convenient for you, then it can be earlier or in the morning. But whatever time you decide, you need to stick to it. And you will take the same amount of long-acting insulin every day unless the diabetes team tell you otherwise. This diagram will hopefully give you a better idea of how the two types of insulin work. This line shows the fast-acting insulin. Its effects work quickly and it doesn't stay in your body for very long. You can see how it is needed at about the same time as you eat your meals. This line shows the long-acting insulin that you will take once a day. It is slow and steady and it stays in your body for much longer than the fast-acting insulin. Your mealtime insulin will vary depending on what you eat. If you have a big dinner and a small breakfast, then you may need to take more insulin before your dinner than you do before your breakfast. So that is why it is very important to keep a record in your diary of what doses of insulin you are on. You may need to have insulin with the snacks as well. The diabetes team will let you know if this is needed and talk to you about it. Your rapid-acting insulin and your long-acting insulin will come in different colour pens, so you don't get the two kinds of insulin mixed up. However, it has happened before. If you do get them mixed up and inject the wrong type, don't panic. You will need to contact your diabetes team for advice. You will be told to test your blood glucose regularly, every 1 to 2 hours for at least the next few hours. You may need to eat a large snack with lots of carbohydrate, but it is important that you contact your diabetes team as their advice will be individual to you.